Role of community and public health in the well-being of populations. Reduce disparities in access to primary care services and care coordination. Access to timely and needed primary health care services continues to be a major challenge for racial and ethnic minorities. The recently released Centers for Disease Control and Prevention report, Health Disparities and Inequalities, demonstrates that African Americans, Hispanics, Asian American, and American Indian and Alaska Native populations suffer higher mortality rates than other populations. 28 cardiovascular diseases, for example, account for the largest proportion of inequality in life expectancy between African Americans and non-Hispanic whites. The public health organizational structure. First, there's the Executive Secretary, Office of Health Reform, Office of Intergovernmental and External Affairs. The following staff offices report directly to the Secretary. Office of the Assistant Secretary for Administration, reporting to the Assistant Secretary for Administration, Office of Assistant Secretary for Financial Resources, Office of Assistant Secretary for Health, and Office of Minority Health, and many, many others. Legal and ethical dimensions of public and community health service. Public health is oriented toward the analysis of the determinants of health and disease on a population basis, while medicine is oriented toward individual patients. Public health is the study of the legal powers and the duties of the state to assure the conditions for people to be healthy. Analyzing funding for public and community health service. Center for Disease Control awarded $211 million across every state. Obesity costs this country $147 million a year, while tobacco costs $96 billion in direct health care costs each year. The agency awarded $211 million across every state will be used to fund evidence-based and innovative partnership approaches to improve the health of Americans. A majority of these grants are from the Prevention and Public Health Fund, the nation's first mandatory investment toward preventing disease and illness. To reduce health disparities and prevent obesity, diabetes, and heart disease and stroke, $69.5 million has been awarded to 17 states and 4 large cities. The recipients will support environmental and system approaches to promote health and make the healthy choice the easy choice. They will specifically focus on people with uncontrolled blood pressure who are at risk for developing type 2 diabetes. Also, recipients will be required to promote connections and collaboration between the clinical setting and the community.